If you're thinking about undergoing sinus surgery or your ENT doctor recommended it, try these 7 proven and natural steps before undergoing surgery. Hi, I'm Dr. Stephen Park. I'm an ENT surgeon and sleep medicine doctor and author of the Amazon best-selling book, Sleep Interrupted. If you continue to suffer from the pain and misery of recurrent or chronic sinus infections, then this video is for you. Some of you are likely considering sinus surgery after trying multiple medications, including antibiotics, all without relief. You may have even tried other natural options such as saline irrigation, herbal teas, or essential oils, but with no success. Stick to the end and I'll reveal why you have to breathe through your nose to prevent sinus infections or even infections in your lung. Now, the word sinusitis is a generic term meaning inflammation or infection of the paranasal sinuses, which are the air pockets inside your facial cheekbones and between and above your eyes. It can be caused by anything from viruses, bacteria, funguses, allergies, pets, acid reflux, and even neurologic inflammation. Most of the time, inflammation or irritation from the sinuses from any of these causes will cause pain, pressure, and discomfort. Only if the inflammation persists and the sinuses get blocked can it lead to a bacterial infection. And even then, by decongesting the sinuses, the body can heal on its own. But sometimes you need additional help. Before I go over the 7 unconventional ways of avoiding sinus surgery, let me describe 2 major revelations that I had early in my career as an ENT surgeon. Back then, I did a lot of sinus surgery in the operating room. What I began to see was that the vast majority of patients that didn't respond to conventional medical treatments for chronic sinusitis snored heavily, and most were eventually found to have obstructive sleep apnea. After treating their sleep apnea formally, not only did they sleep much better, but their sinus problems became much better as well, lessening the need to go to surgery in over 50%. This then led to my second revelation that acid reflux, chronic sinusitis, and obstructive sleep apnea are all related. There are numerous studies showing strong associations between each of these 3 conditions. For example, if you treat acid reflux, sleep apnea and chronic sinusitis improves, and if you treat sleep apnea, sinusitis and reflux improves. And this makes sense since when you stop breathing at night, you'll forcefully suction up normal stomach juices into your throat, which can then reach your nose, ears, sinuses, and even down to your lungs. You have to remember that your stomach juices contain not only acid, but also bile, digestive enzymes such as pepsin, as well as lipid-laden macrophages. So you can see how this can cause major inflammation in all areas of your upper and lower airways. And this is what led to the creation of my sleep breathing paradigm, which I read about in my book Sleep Interrupted. As you can imagine, stomach juices can cause massive inflammation in your sinuses, which sets you up for viral or bacterial infections. So here are the 7 unconventional ways to avoid sinus surgery. Numbers 1 to 3 are all related to what I described before, which is the connection between reflux, chronic sinusitis, and obstructive sleep apnea. Number 1 is to treat your acid reflux. The conventional way is to use either the over-the-counter acid reducers such as famotidine, the brand name is Pepcid, or omeprazole, which is Prilosec. Because of many potential complications, it's probably not a good idea to take these medications long-term. There are lots of non-prescription resources that you can find on how to treat acid reflux, but the most important thing to start off with is to avoid eating or snacking within 3 to 4 hours of bedtime. I'll be posting another video in the future about 7 natural ways to beat acid reflux. As I mentioned before, there are studies showing significant improvement in chronic sinusitis symptoms after a trial of acid reflux medications. None of these acid reflux medications actually prevent reflux. All they do is to lower stomach juice acidity, but they don't do anything to lower reflux. I also noted in another video that the sleep hormone melatonin is released about 2 hours before your natural sleep time. But if you use a screen just before you go to bed, the blue light blocks melatonin production, so you have trouble falling asleep. But what most people don't know is that melatonin also lowers stomach acid production, as well as to tighten the lower esophageal sphincter. So if you delay melatonin as you go to bed, you'll have more acid reflux. And number 2 is to get diagnosed and treated for sleep apnea, especially if you fit the classic criteria such as having heavy snoring, unrefreshing sleep, morning headaches, lack of energy, and being overweight with a big neck, and any of the metabolic complications such as diabetes, high blood pressure, heart attack, stroke, anxiety or depression, cancer, and even sudden death. Even if you're not overweight and you don't snore, you can still stop breathing many times an hour, which leads to acid reflux. Apneas happen when your breathing gets obstructed, and this creates a suction effect in your throat and chest cavity, and this ends up bringing up small amounts of acid into your throat. You can find out much more information about how to treat obstructive sleep apnea on this channel, my website at drstephenpark.com, and my book or my podcast. Number 3 is an accepted way to treat sleep apnea, which is tongue exercises, otherwise known as myofunctional therapy. It's been shown in a recent meta-analysis that it lowered sleep apnea severity by 50% on average and by 60% in children. There are lots of free and paid online resources, but you'll get the best results if you see someone live. Number 4 is something you may be surprised to hear about, which is to take an antibiotic. Not just any antibiotic, but any in the antibiotic class called macrolides. This includes any medication that ends with the words mycin, such as erythromycin, clarithromycin, and azithromycin, which is Z-Pak. It's been well documented that these antibiotics have an anti-inflammatory property, and there are numerous studies on the beneficial effects of using these antibiotics for chronic sinusitis. And this is despite the fact that these classes of medications are not that great at killing the most common species of bacteria that causes chronic sinusitis. But the most interesting property that's also been well documented is their promotility properties, meaning that it helps to empty the stomach and move the bowels along faster. I remember in general surgery, we frequently had to give intravenous erythromycin to promote gut function after abdominal surgery. So how can these antibiotics prevent sinus infections? You can argue that they can kill the H. pylori bacteria in the stomach that's known to cause ulcers. But by emptying the stomach faster, there's less time the stomach lining is exposed to acidic juices, and less of these juices can go up into the upper airway, especially if you have any apneas. It's also interesting to note that the same inflammatory markers that go down after using these antibiotics are the exact same markers that go down after you treat sleep apnea with CPAP, such as interleukins 2, 4, and 6, vascular endothelial growth factor, tumor necrosis factor, and C-reactive protein. As you may know already, it's generally not a good idea to take antibiotics long-term, so I don't recommend you go this route. One of the many known side effects of long-term antibiotics use is damage to the gut flora. I only bring this up to make the point that anything that helps to empty the stomach faster and lower acid reflux will help with sinus problems in general. Number 5 is something that you may not know about, which is xylitol. This is a 5-carbon non-absorbable sugar that doesn't make your insulin go up. A small amount is also made by your body while it metabolizes other sugars. And there are a number of studies showing that xylitol spray or irrigation improves nasal and sinus symptom scores significantly. The theory behind how it works is that the bacteria take up the xylitol as food, but ends up dying since they can't process it properly. It also has numerous other dental benefits, including controlling cavities and gum disease. For more information about the health benefits of xylitol, look up Dr. Ellie Phillips for more information. She has a great book to read called Kiss Your Dentist Goodbye. Number 6 is to use near-infrared light therapy. I've talked before on the many health benefits of near-infrared light therapy in a previous video called Melatonin's Surprising Health Benefit. Briefly, the near-infrared spectrum of light, which you can get by exposing yourself to sunlight early in the morning or late in the afternoon. It's also been documented that near-infrared radiation light is antimicrobial, meaning that it can kill viruses, bacteria, and funguses. And here's an interesting study that found that treating hospitalized COVID patients using an infrared light vest over the chest left the hospital over 4 days earlier compared to people who didn't get it. And also a number of other inflammatory markers went down as well, including oxygen level, heart rate, blood pressure, and white blood cells. And lastly, number 7, another surprising thing to think about, which is vitamin D. Here's a systematic review on the relationship between vitamin D levels and chronic sinusitis. Lower levels of vitamin D were associated with higher levels of sinus inflammation. Obviously, this doesn't imply cause and effect, but based on all that we already know about the importance of vitamin D in every area of human health, these results are not surprising. Remember that vitamin D is not a vitamin, but a hormone. I'll place a link to a chart that compiles all the documented health conditions helped by adequate levels of vitamin D. This is why you should get your vitamin D levels above 50 or even 60, but not beyond 80 or 90. And here's the bonus tip. If your nose is stuffy for whatever reason, you won't create nitric oxide from your nose and sinuses. This molecule has powerful antimicrobial properties, including its ability to kill bacteria, funguses, and many viruses, including coronaviruses. When it's inhaled into your lungs, it has the same effect on various microbes, as well as raising your oxygen levels by 10 to 20%, and this is done by dilating the lungs' blood vessels. This is why it's so important to breathe well through your nose. I'll place links to all the videos I did on this topic below. I hope you found these tips helpful, even if you aren't thinking of undergoing sinus surgery. As you can see, these concepts are critical to understand and apply so that you can breathe better and sleep better. This way you can have the extra energy to thrive and enjoy your life to the fullest. I also mentioned in the beginning that most people with sinus infections have problems sleeping. If this describes you, click on the link above to find out why you can't sleep.